I'll quickly go through my experiences so far in terms of our approach to, I wouldn't say quite developing a wealth building strategy, probably not quite there yet, but we're certainly working towards one. And I'm sure all of my colleagues from across Scotland were probably in a more mature position than NHS Golden Jubilee at the moment in time. The next slide, please. Yeah, just a quick bit of context in terms of who we are. NHS Golden Jubilee is composed of not only the National Hospital, but also the host of the NHS Scotland Academy. And also we have a 4-star hotel on site, so not everybody is aware of that. But principally we're a national hospital that specialises in heart and lung diagnostics as well as orthopaedic surgery and ophthalmology. So we're a kind of strange situation where we're a national hospital located in a very kind of niche area of Scotland. So people often get confused of our role in a local context. But at the same time, the number of procedures have escalated over the past couple of years due to the expansion of our hospital, both in terms of a new surgical centre and a new ophthalmology centre. And then we have a 160-bed hotel on site that principally catered for patients, but it's open to the general public at the same time. Next slide, please. So just to give you a bit of context of where we're based, so you can see, if you can see this map, we're just approximately 7 or 8 miles west of Glasgow, city of Glasgow. We're actually in a different local authority called Western Bartonshire. So we're out with the city of the Glasgow area, and you can see the green arrow in terms of our proximity to both the boards of Ayrshire and Arran, and also in terms of Greater Glasgow and Clyde. So there's quite a lot of interaction between both communities. Next slide. So in terms of the challenges and in terms of why we're approaching or working towards an approach towards being an anchor or maturing as an anchor organisation, Western Bartonshire itself has significant challenges, both in terms of being one of the most deprived areas in Scotland, or most deprived local authorities in Scotland. We also have significant issues around life expectancy compared to the rest of the country. People often leave the area for work purposes, so it's an area of net out migration. Unemployment is quite significant compared to the rest of Scotland, as well as workless households, and the level of qualifications amongst the population is significantly lower. So what you see there is SIMD map in red, and I'm sure you're very familiar with that in terms of some of the factors that contribute to deprivation, notably access to health, access to education, crime, and so forth. So that's one of the reasons in the rationale. We have a vested interest as a national hospital based in Clydebank to provide and support the local community with a range of interventions. So in terms of making the case, so I'll go on in terms of some of the learnings in the future slides. But in principle, in getting started, and if there's anyone getting started in approaching this kind of mode of working towards becoming an anchor organisation, it's always very important to gather the evidence. So just like understanding the deprivation rates, the challenges around the area, around both from an economic perspective and a social perspective, undertaking some gap analysis in terms of what the current situation is right now and where you want to get to. And also significantly, and it's quite important as well, is to do that internal consultation exercise with local people within your organisation to understand where those priorities lie. At the same time, and we did some analysis through the Joseph Rowntree Foundation in terms of progression framework. So worked alongside some of our key teams to understand what activities we're undertaking and measuring the progress around those. So it gave us a kind of a maturity score that allowed us to work with the information we got from the gap analysis to determine what the kind of strategic priorities might be for the organisation. Probably the most important thing is to get also board sponsorship. So over a period of 12 months, I was advocating an approach to an anchor organisation, canvassing the board members and the executives to really embark on a formal project. And luckily enough, my direct report, who's now an executive director, Carol Anderson, endorsed the view that we should be taking a formal approach and a formal programme should enter into the portfolio of the organisation. Hence, we created a more structured approach for delivery. So just to give you a sense of some of the key activities towards this development. So as I mentioned before, 2022 was about introducing the concept and canvassing the idea. From my previous economic development experience, I had some kind of know-how in terms of how to maybe set this up and engage with stakeholders. But at the same time, the Scottish Government was taking an active look at how the NHS boards can really contribute to local economies. So it kind of coincided. It was quite a good marry of approaches. So you can see in 2023, we worked towards developing an anchor strategic plan that was submitted to the Scottish Government around October 2023. But a whole host of activity was undertaken prior to that I mentioned before. And in 2024, it was more about monitoring our plans and taking a more strategic view of the hospital's role in becoming an anchor organisation, looking at more kind of external outlook and how we can do a more joined up approach and thinking. Just to give you an indication of our programme structure and how we pull this together. So I mentioned before, we have a suite of strategic projects we're looking at. The traditional anchor plans, so focusing on workforce procurement and land and estates, as well as supplementary activities of stakeholder engagement and governance. And Public Health Scotland have been taking a very active role on behalf of the Scottish Government in terms of providing advice and providing that peer-to-peer support to allow boards to really put things into practice and get guidance in terms of future activities. Just give an example of some of the work we've been doing with our teams. So, for example, developing a procurement plan that relates to anchor priorities. So this is something that we pulled together with our procurement team in terms of using some frameworks already out there. I think this is a UCL framework in terms of focusing their minds in terms of clear outputs and outcomes. And you'll see one in the next slide we developed with HR, and that's just a snapshot. This goes over maybe 5 or 6 pages around some of the outcomes and impacts that we wanted to tease out. So we wanted to make it really tangible, real clear measures and timelines in terms of how are they going to impact the local community. In the main, most of this activity was already in place, but there wasn't that clear identification of targets and smart targets and how they contributed to the overall agenda. So in terms of more strategic activity, so Western Bartonshire has some significant challenges, and they can be summarised, and this was a report done by the University of Strathclyde. 3 key areas that we wanted to focus on and align our activity with, and that was around population decline, economic recovery, and inequality and poverty. And then in the next slide, we'll kind of showcase how we are now aligning our activity to those grand challenges. So specifically, and a lot of our time is taken up by addressing the child poverty issues at the moment. I think 25% of the population, of child population in Scotland lives in poverty, which is a scandal. So we're looking at working with Western Bartonshire Council when we're part of a wider programme with other partners and how our contribution can alleviate some of those issues. If you look at economic regeneration, we're looking at supporting the council as well in terms of redevelopment of Clydebank and how it links up with the hotel and the hospital footprint. Our partnerships with the University of Strathclyde in Glasgow. Just go back to the previous slide. Yeah, in terms of how we open up our university capabilities to the local community, kind of falls under the economic regeneration activity. But I think something that we're doing in-house is looking at digital pathways and securing more individuals to come work with us and providing them a pathway and a career pathway and seek them out from local schools and colleges rather than then moving out into other areas like Glasgow and Edinburgh seeking career opportunities. So these are some of the kind of small to large level interventions that are pulling together that align with some of the priorities of Western Bartonshire.
Just a minute or so left, Abu, if that's okay. This is great stuff. Super, super interesting to see this level of detail.
Next slide, please. Yeah, just to give you an example, we're located right on the Clyde there, and some of the wider infrastructure developments, and we're part of that wider picture of regeneration in the North Clyde area. So going forward strategically, how do we connect the dots, and how do we attract or be a conduit to further inward investment across that area is a key driver for myself. Next slide, please. Yeah, just so last slide. So just in summary, so some of the key learnings. So I think for those on the call and listening into this, decades of neglect can't be shifted very quickly. So it's going to take a few years before we see real impacts of anchor work. Specific anchor work is already high in the agenda. So I mentioned child poverty, and local governments and national governments are taking real interest to that. And one of the big things are people drive interventions, organisations don't. You need people who are really interested in changing the lives of people, changing their issues and challenges, and help them get through difficult periods in their life. So it's not policy. It's not policy certainly helps with that, but it's people that you need to connect with to drive and make those implementations. And it's local people have a vested interest. Seek out those within the organisation who live in the area, who understand the challenges, and work with them to understand how they can help and shape policy of the organisation going forward. And I'll pick up some key success factors as well. And one thing is sharing stories, and you need to be really emotive. So, for example, we take child poverty and how that impacts families, and how that impacts the wider communities, and how that creates those challenges for individuals as they go through primary school and secondary school, their opportunities to go into education and their opportunities to go into the workplace. We need to really start making moves right now at a local level to challenge some of those issues. If you think about it, one in four children are going through those struggles in probably one of the fourth or fifth richest countries in the world, according to the data and the news. That is a national scandal. So I think there's a role for public sector, there's a role for anchor organisations to really make a real contribution to the way we work within our local communities. Understand NHS are under significant challenges around resources and finances, but we can really optimise our services and activity to really make a long-term impact.